campuses. So.
I'm streaming this as well.
Okay, cool.
Okay, so see a couple people have joined in. That's pretty good. And then we'll have more people watching on Facebook who are not Vanderbilt affiliated. But welcome, everybody. Thanks so much for joining. I'm Rourke Swady-Stata. I'm the president of Vanderbilt Libertarians. Today, we have with us Yaron Brook of the Ayn Rand Institute. He's the co-founder of BH Equity Research. He serves on the board of the Ayn Rand Institute and the Institute for the Study of Capitalism at Clemson. He's a member of the Association of Private Enterprise Education and the Mont Pelerin Society. So please welcome him, everybody, and he will be discussing COVID and the failure of the regulatory state.
Thanks, Rourke. Is that named after Rourke?
Yes, it is.
Excellent. All right, so I assume everybody knows that is the lead character in The Fountainhead. So excellent. All right, so I thought thanks for having me. This is great. I really appreciate it, and it's always great to talk to students on campuses. It's just too bad I can't be with you on campus. That would have made this a lot more fun and a lot more interesting. I'm going to talk for 20 to 30 minutes, and then we'll open it up to Q&A and see what you guys want to talk about. So I talk a lot about capitalism, socialism, the morality of capitalism, why capitalism is a better system, and all this stuff. But I've decided, given what's going on with COVID is a great laboratory for us to be able to view the consequences of statism on the one hand and of whatever freedom we still have in our society on the other hand. If there's ever been basically a global massive screw up by government, COVID is it. You guys kind of at school, now really, we can't go anywhere. We have to wear these masks everywhere. People are indeed dying in hospitals because of COVID. And I would argue all of the last year, all the deaths, all the destruction of small businesses, all the destruction of property, of wealth, of education was unnecessary. It was unnecessary because this is a relatively, as pandemic goes, mild pandemic. And it is a pandemic that could have been dealt with if we had approached it rationally. So, but because everything with regard to this pandemic is being top-down, government-oriented, state-centered, the government has dictated every aspect of this, and they have elevated central planning to a level that we really haven't seen, I think, in modern America, or in Americans' history, maybe with the exception of warfare. And it has been one massive, unmitigated disaster. And I want to take just two small examples of this that we can talk about today that relate to COVID and relate to kind of the response to COVID. One relates to testing. I want to talk about testing. And the other relates to the vaccines. Right? Now, how do you deal with the pandemic? Well, you deal with the pandemic the way Taiwan dealt with COVID. Taiwan is really the only country I know of that dealt with this pandemic the way the textbook says you should deal with the pandemic. It's not an accident, I think, that the vice president of Taiwan happens to be epidemiologist. And they know how to do this, and they did it from day one. First of all, they started out by not trusting the Chinese. Any information out of China about diseases is suspect, particularly to other Asians who have experience with being conned by the Chinese. And then they did what you're supposed to do during a pandemic, which is simple, 3 steps. You test, you trace, you isolate. If you do that, you get a pandemic under control very early. And in Taiwan, 8 people have died from COVID. 8 people have died from COVID, a population of Actually, I'm not sure. But I assume, 20, 30, 40 million people, right, with 8 casualties. And all because they test. They test aggressively. They test often. They test everywhere. They trace who you've been exposed to, who might have gotten it from you. They test those people. And then if you've got it, they isolate you. They ask you to self-isolate. It's simple. It's what the textbook says you should do. It's what the CDC says you should do. But, of course, it wasn't what was done in the United States. It wasn't what was done in Western Europe at all. So let's trace a little bit about what happened in the United States, at least, and this was mimicked in Europe. First of all, there was general complacency. Nobody seemed to care. The one job of government, which is to protect our rights and maybe, monitor for pandemics, they didn't do. They're far too busy regulating and controlling and redistributing our wealth than to actually do the job that they are supposed to be doing. Then when it came to testing, the CDC, a government central planner, decided that they were going to design the test. And they spent 4 weeks designing a flawed test, a test that didn't work. A test had been designed earlier. The Taiwanese had a test. Other countries had a test. But because of Donald Trump's America First attitude, we didn't want a foreign test testing Americans. We wanted an American-made test testing Americans. Not at any point, until it was too late, did the authorities go to the private sector and say, hey, design a test. Indeed, they did the opposite. The private sector was banned from providing a test. University labs that had testing equipment were ready to go out and test for COVID were basically told, you're not authorized by the FDA, you're not authorized by the CDC, you cannot deploy your test. For 6 weeks, from the days when in the US they knew COVID was contagious and likely to become a pandemic, and the CDC started to design a test, for 6 weeks there was no testing basically in the US because everything was looked upon to the government to provide everything. And they failed, which is not shocking. Contrast this to both Taiwan and South Korea, where what they did in order to test quickly, and they did a lot of testing, much more than the United States on a per capita basis, is they went to the private sector and they said, design tests, go for it, quickly, we'll approve them quickly, and go and just start testing people. That happened in South Korea. To this day, it's like a hassle to get a test in the US. I mean, some places are better than others. Like California is fairly good. You can do a drive-through, but other places are complete miserable. From day one in South Korea, you had drive-through testing. You had testing in Taiwan. You had testing everywhere. In the United States, we completely blew this. Private labs, private companies, universities, none of these facilities were allowed to provide testing. Indeed, even today, if you wanted or 6 months ago, 9 months ago, one way to eradicate a pandemic, to eradicate COVID, is to allow us to test at home, to provide simple tests that every time you go outdoors, you can test yourself. Anytime you go in front of other people, you go to a class, you go to a party, you go to a bar, you go to a restaurant, you test yourself. If you're contagious, you stay home, you self-isolate for a while. If you test negative, you go out because you're probably not going to infect anybody. These tests exist. They were developed by a company in Massachusetts. They cost $1 a test. You could theoretically get a pack of 20, have them at home, every 20 days replenish them, and basically test every time you go outside and interact with other people. Why don't we have these tests? Well, because the FDA doesn't approve them. They're not sensitive enough. But we're not testing for sensitivity. We're testing for contagiousness. And these tests are excellent at telling somebody whether they're contagious or not. So if you want to stop a virus, the people who have it, stay home. It's simple. But the people who don't have it, live, interact, go to bars, go to restaurant, go to class, live their lives, open up their businesses. And how do you tell who has it and who doesn't? Provide cheap, effective minimally invasive tests that anybody can use that are simpler than a pregnancy test. It's funny because right now in the market, there are a few tests that the FDA has approved, right? They've allowed us to test ourselves. I mean, imagine, right? Well, people say we need an FDA, we need these regulatory agencies. Why? Because it's dangerous, right? People will sell us dangerous products that will do us harm. It's a test. You're not going to get damaged by a test. A test might be inaccurate. It might be fraudulent. Well, then the FDA should catch frauds. But other than that, leave us alone. But right now, there are 3 tests out there that you can buy and bring home. One of them you have to mail in. It takes days to get the answer back, so what's the point? Another one, which is really cheap, it's like $10. The FDA has required that with every box of these tests, you have to buy, by law, you have to buy an app. The app makes the whole thing cost $50. Now, a lot of people can't afford it. So, other tests require you to get a doctor's prescription. The bureaucracy, the ineffectiveness, has just created a situation in which we have, a pandemic out there where people are dying unnecessarily. It's just, and again, you guys are not in school and not in classrooms live for no reason. We can't go to restaurants, we can't go to bars, we can't live our lives, we shut our businesses. I mean, think of the number of people who have put their blood, sweat, and tears into starting a business, into starting a restaurant, have worked amazing hours, have survived, and then some bureaucrat comes around and says, no, you shut down, you can't open up, you can't even have tables outside. All your efforts are gone. You should come groveling to the government. We'll send you a check. We'll stimulate you. We'll send you, some money to appease you. But the business, forget it. It's gone. Thousands of businesses in America have gone bankrupt because of the government's response to this. When we had solutions early on. If we just done this right, we could have sold this easily. Forget the conspiracy theories. Forget all the people telling you there isn't anything there. There's no disease. That's not the issue. COVID is real. The issue is the simple, straightforward market solutions to this. The government has ignored. The government creates obstacles before. And it has resulted in the death possibly of, I don't know, according to their numbers, 400,000 people. Imagine what would have happened in a free market. In a free market, there would have been huge incentive to develop tests. There would have been huge incentive to develop large quantities of tests and get them out there very, very fast. If the government had restricted itself to tracing and isolating, this could have been over with in a month or two. So just the testing, and by the way, all this information about the existence of instant tests that you can do at home that are quick and easy to use, the fact that the CDC completely messed up its original test kit and refused to approve tests by private companies, all of that is publicly available information. All of that is being publicized by the mainstream media. Nobody cares. Nobody cares. We all still grovel before government and believe that it is the solution to all our problems. This is an opportunity for those of us who believe in markets to point out and to make a big deal out of the failure and out of the alternative, what the alternative solutions would be. I want to give you one other example of this, which is, again, shocking in the very fact that it could have saved hundreds of thousands of lives, maybe millions globally. And that is the vaccine example. Do you know how long it took Moderna to design the vaccine? From the publication of the genome of COVID, which some brave Chinese scientists did in mid-January and later disappeared for a while because the Chinese government was not happy that they had published the genome, but they published the genetic sequence of the virus online in mid-January, how long did it take Moderna, a private company, to develop a vaccine off of that genetic sequence? 2 days. A weekend. 2 days. Within 2 days, there was a vaccine for COVID, at least on paper or in a computer, right? It then took them about 3 months to produce the vaccine and to do what's called phase 1 tests, which guarantee its safety or test its safety. So by late April, early May, there was a vaccine that we didn't know how efficacious it was. We didn't know how good it was, but we knew it was it was safe. Now imagine if in late April, Moderna was able, as it would be in a free market, to say, look, we think we've got a vaccine. We're not sure exactly how well it's going to work, but hell, things are really bad. Anybody who wants this vaccine, you sign this disclaimer. You sign that you know you're taking a risk. You sign that you know it hasn't gone through phase 2 and phase 3 trials, and you can get it. Now, maybe there would have been some hesitant people in the beginning, but my guess that a few million of people, several millions of people would have been vaccinated through the summer, and by the time we got to the fall with the spike in COVID cases, potentially tens of millions of people would have been vaccinated. It turns out the Moderna vaccine is unbelievably safe. It turns out it's unbelievably efficacious. By the time we are right now here, not only would hundreds of thousands of lives have been saved, but it would be over. We'd, again, be all vaccinated, and we would be back in classrooms, pubs, bars, restaurants, and so on. Businesses would be open again. The private sector did a phenomenal job at developing these things fast. But what slowed it down? What made it impossible for, I still can't get a vaccine. I could pay $1 million and I can't get a vaccine. Nobody will sell me the vaccine. Because the only people allowed to distribute the vaccine are whom? Who the only entity allowed to distribute the vaccine? Government. The federal government gives it to states. The state governments decide who gets it, CVS or whatever. But then they get lists of who can get it and who can't. If you're over 85, 75, 65, you've got certain comorbidities. So they decide who should get it. Now it turns out, from a purely epidemiological perspective, it's not clear that old people should be getting vaccine. The people who should get the vaccine are the people who might give it to the old people. Caregivers, people in hospitals, certainly medical professionals, but people who go to bars should be getting the vaccine. They're much more likely to infect other people than somebody stuck in an old age home at age 91, who's probably going to die in the next couple of years anyway. Why is he the first priority to get the vaccine? Imagine if we had vaccination stations outside of bars. The amount of distribution of this virus would collapse. Imagine if you distributed the virus based on the pricing mechanism, based on who's willing to pay for it. Like who do you think would pay for vaccines if it was available to anybody? Yeah, rich people would, but there are not that many rich people. Who other than rich people would pay for the vaccine? Well, hospitals would buy huge amounts of vaccines to vaccinate their doctors and their nurses. And they have a strong incentive to have their healthy employees to be able to treat patients who pay their bills, and that's how the hospital makes money. Insurance companies would have huge incentives to buy the vaccine and vaccinate the people who are insured by them. Far cheaper to buy the vaccine and vaccinate the insured than to actually pay for hospital bills. A free market. I mean, imagine if FedEx and UPS and CVS and Walgreens and Walmart and Amazon were responsible for distribution of the vaccines. Imagine if we allowed the price mechanism, so prices would go up dramatically in the beginning, driving more and more production, increasing the supply so that prices would come down over time. There'd be no shortages. There'd be massive vaccination programs, all driven by market forces. We know that the market can deliver huge quantities of stuff. We saw that with like PPE, like masks. Remember there was a shortage of masks? Imagine if you'd allowed the prices of masks to rise. I mean, everybody would be making masks. Everybody ultimately did start making masks. And the shortage would disappear within days. Markets work. Markets work especially well at times of emergency, at times of constrained supply. The pricing mechanism works beautifully. Instead, we get lists designed by central planning ethicists on who should get the vaccine before whom. Do you know in New York State, I don't know what it's like in Tennessee, but in New York, there's a list of who can get the vaccine. And if you give the vaccine to somebody not on the list, you could get fined thousands of dollars and potentially go to jail. So guess what happens at the end of the day? They've gone through all the people. They've still got some vaccines. They have to give them that day, otherwise they go bad. But there's nobody 85 or older. There's nobody who's got diabetes. There's nobody coming in who qualifies by their list. What do they do with the vaccines left over? They put them in the trash. They throw them out. That's government distribution. That's what happens when you go by rules and regulations. I don't know if you know, but Israel has the highest vaccination rate in the world, and one of the reasons they're good at this is because when they run out of people to vaccinate and they've still got vaccines, they go out into the street and they start yelling, "Anybody want a vaccine? Come on over. We'll vaccinate you." Right? So they have rules, but the difference is Israelis are willing to break them, and the bureaucrats are not willing to punish them for breaking them, like they are here at least in New York State, and I think in some other states. We could have had everybody vaccinated by now, easily, maybe even by 3 months ago. Think about the wealth, the businesses, the lives that would have been saved. So look, markets work. I mean, it's kind of funny because it's not like we need more examples to show that. All of history is an example of the fact that markets work, and government intervention in any respect in the marketplace is a failure. All government intervention in the marketplace is a failure. But COVID has illustrated this like never before. It's a massive example of this and of the lives lost because of the bureaucracy, because of the FDA, the CDC. By the way, you remember when the FDA, when Pfizer first came out with the vaccine and they said, it's safe, 94%, and it's efficacious, 94%. And then it waited about a week, and then the FDA said, this looks really promising. We're gonna go into emergency mode, and we're gonna approve this really, really, really fast. So we'll meet in like 3 weeks and make a decision. Like if you told Steve Jobs or Jeff Bezos that there was an emergency and you were going to get them an answer in 3 weeks, you would be fired that instant. You work all night, you get them the answer the next day. If it's an emergency, you get them an answer within hours, not within weeks. Again, only a government bureaucracy that wants to appear like they're doing the right thing, they're being very cautious, they're being careful. But that's the kind of incentives bureaucrats have. And it's the exact opposite incentive that markets have, that companies have, that private companies have. An emergency is an emergency. An emergency means we get it done tomorrow, not we get it done in 3 weeks. Think again about the number of lives lost in those 3 weeks, the number of businesses destroyed in those 3 weeks. That's the cost of the regulatory state. It's life, it's well-being, it's livelihood, it's wealth. It's visceral during this COVID crisis. Now, why is this? And I'll go through this quickly, kind of just a theoretical basis of this. What is it that makes it possible for markets and private entrepreneurs to be so successful and to do to develop a vaccine in 2 days, to develop, amazing tests and to deploy them quickly and effectively. What makes it possible is the human mind. All values, all advances, all technology, all innovation, everything we have around us is a product of the human mind. It's a product of human reason. Somebody has to do the thinking. But thinking requires freedom. The mind requires freedom from coercion, from force, from authority, from somebody telling you, no, it doesn't matter whether you develop it or not. The bureaucrats in the FDA, they're not interested. Well, then you're not going to think about that problem. Somebody's got a gun. Somebody's got authority over you. You'll go find something else to think about. If you're Galileo and you've just made an earth-shattering discovery and published it, that, hey, it turns out the earth goes around the sun, not the other way around, and you're put under house arrest because of that, and you're lucky because people in the past who challenged authority were burnt at the stake, so he was just put out of house arrest. How much thinking is he going to do in house arrest? How many breakthroughs is he going to make in house arrest when he knows what the consequences are going to be? Force shuts the mind down. The essential reason we must be free, the essential reason liberty is a value, is because liberty is what frees up the human mind to imagine, to create, to innovate, to bring about the values that are required for our survival as human beings, for our flourishing and happiness as human beings. So the first thing that is required in order to get innovation and distribution and the creation of values is freedom, the freedom of the mind. The second thing is the central planners assume that they know what's good for us. They assume that they know what our values should be. They assume that they can think for us. Now, Hayek would say, they can't. They're just not smart enough. They can never be smart enough. And what the central planners say is, no, we're getting smarter all the time. And by the way, we're going to have AI soon. And when we have AI, we're going to be super smart and we're going to be able to run all your lives. So don't worry, central planning will work one day, right? This is the dream of the socialist. But that's not the point. Hayek is wrong. The point is not that they're not smart enough. The point is not that there's not enough capacity or not enough rationality. The point is that the task is impossible because your values are your values. Only you can know them. Nobody can know what your values are. Nobody can know how much you value your life. Nobody can know how much you would be willing to pay for a vaccine. Only you know that. And therefore, no matter how much computing power you have, unless they're literally directly hooked into your brain and know exactly what every preference you have is, and I'm not sure that's possible even if you could hook up into the brain, right? They cannot know what you want, what's right for you, what's good for you. Values are values of an individual. They're not values to be commanded, and they're not values to be, forced down your throat. Central planning cannot work ever because a central planner cannot know what's good for me. And nothing is good for me. Nothing is good for me at the end unless I choose it. So, central planning, regulation are basically coercion, force, judgment. They're the things that shut down the mind. They're the things that make your values irrelevant. They're the things that destroy progress, innovation, creation, building, making. What we need is for government to do the one thing it's supposed to do, and it's only supposed to do one thing. And that is to protect individual rights. And that excludes all regulations, all types of regulations. It means governments are there to protect us from other people coercing us. But other than that, leave us alone. Government should never coerce. When they do, what you get is destruction. What you get is death. What you get is, businesses and individual lives failing. So, freedom works, markets work, capitalism works, individual thinkers work. When we leave people alone, they produce amazing things. They create amazing stuff. The COVID is nothing when compared to the ability of human beings to create and to innovate and to embrace ingenuity. Human reason can overcome any one of these things, but all of that requires freedom. All of that requires government to get out of the way. And, when we face a crisis like we're facing right now that has uprooted our lives and turned it upside down and been so destructive, this is a time to remember, not, as I think most Americans are, running to government for help and begging for assistance. No, this is a time to point out that this devastation was caused by them. Not that the virus was caused by them, but our inability to deal with this virus, our inability to come out of this healthy and well, was caused by them. So use it. Read about it. Use it as an example, another among the thousands of examples of the destructive nature of government and how if we just left marketing alone, we would have been out of this 10 months ago. Thanks. We'll take any questions you guys have.
Thank you so much. If you guys just want to shout out your questions.
Isaiah has his hand up. Do you unmute yourself? There you go.
Oh, sorry. That was just a clapping emoji.
Okay.
But I really enjoyed your insights that you had. I'm going to think of some questions here.
Sounds good. Anybody have a question? Just jump right in if you do. About anything. It doesn't have to be about this topic.
You mentioned the way that Taiwan was it, that you respected how they handled the pandemic, correct? So the different testing and things that they did there, was that all optional, or did they imbue some type of force upon like the mass levels of testing that they've been doing?
I'd say the only, you could argue the only force they used was on at airports. So if you came in, they took your temperature. But that's not, is that force? They have these electronic things that even non-COVID time, when you walk into an Asian airport, they've got these things targeted at you measuring your temperature. I don't consider that force. I consider that part of a legitimate function of government to make sure that you're not bringing in you're not sick when you're coming into their country and could inflict disease on other people, which is force, right? Other than that, the testing was voluntary, but of course, a rational people, why would you not want to be tested, right? Not being want to be tested means you don't care about your own health. Not wanting to be tested means you don't care about other people. Like, I'm an objectivist. I'm like the most selfish person you'll ever meet, right? And proud of it, and this is my moral principle. But I care about other people because other people are part of my life, right? I don't want to just inflict pain on other people for nothing, for no reason, right? Some people I don't mind inflicting pain on. But generally, right, particularly strangers who that was a joke, but particularly strangers who I don't know, I don't want to inflict pain on them because I'm selfish, because I care about my life, I care about other people's life. So this idea, if you make it voluntary and you make it easily accessible and you make it super cheap and you explain the consequences, people will do it. Now imagine if COVID was like Ebola, where if you get it, the chances of death are 40 to 50%, but it is as contagious as COVID, right? If you screw up testing, you wipe out the human race, potentially, right? And if you screw up a vaccine, you wipe out the human race, potentially. But this is what giving government the power that we've given it entails. because we are one day going to get a virus that is as deadly as Ebola and as contagious as COVID. And if we leave it to the central planners to arrange, we're dead. So we better wake up. We better figure out that this is not the way to deal with this.
Thank you.
I would like to say, just first of all, thank you so much for coming. This has been very fascinating. I find a lot of what you said, I want to express some respectful disagreement. I'm a little all over the map politically, personally, but sure. I definitely take your points about overregulation being a problem and the pacing of the permissions with. Those are serious, genuine failures of our public health bureaucracy in the United States, and I don't disagree with that. But I feel like your framing of the issue between private sector versus public sector or government control, more or less of that, is just isn't quite right. For example, just take one obvious example. I think China has far more government control and government presence in people's lives. And although they started the pandemic and early on they were very shady with their public messaging, within a couple of months, they massively reduced the presence of the virus. Their case numbers are proportionally lower than in the United States. They've made great successes against it. I don't really see that as, the pathology of just more and more public control. I see that as a cooperation between the private sector and the public sector. In the same way that, in the United States, we attempted to do something similar already with Pfizer, Moderna. Those are private pharmaceutical companies, or they're publicly traded, but they were cooperating with the United States government. We just did the cooperation more poorly. But I mean, South Korea, so it's not as if we didn't open it up to the private sector in all the same ways. I know with testing, maybe not, but I have, you can stop me there.
Yeah, so first, look, there is no question that one way to deal with a pandemic is to lock everybody up. I could tomorrow stop rape in the United States. We could end rape in the United States. You basically make it illegal for men to leave their home. I mean, that's it. And there's no rape anymore. I mean, if the standard is, if you allow for the ability to just, on a massive scale, we're talking in China, millions and millions of people, just being locked away and facing unbelievable penalties for leaving their homes for months, for weeks in Wuhan province, then yes, you can do stuff. Now, I wouldn't call that private-public partnerships. I would call that a big authoritarian dictatorship imposing itself, and force in a very narrow scope like that can work in short periods of time. But you're giving up a huge amount in order to do that. Now, that's exactly what happened in China. It's exactly what happened in China.
But this strikes me as an unconvincing analogy, because if we could end rape by locking down for 1 week and then we leave, it would be devastatingly unethical for us to not. I mean, imagine if we could actually end all sexual assault in the entire country forever. If everyone would just get in their home and wait, because it's like somehow a contagious disease.
So assume. Okay, so
it doesn't make any sense, because you're not accounting for
how many weeks. How many weeks?
To me when the way you're framing it.
No, I get it. How many weeks would be okay to lock people up for in order to eradicate rape? 3 weeks.
We'll make it a representative comparison and say about 2
6
weeks.
months?
That's what it would have taken. That's what South Korea did.
No, South Korea didn't lock anybody up. It didn't lock down at all. There was no lockdowns. Lockdowns maybe.
Not South Korea, China. I'm sorry.
China locked down whole cities for weeks. It was willing to lock them down for as long as it took. At a mortality rate of what? We're talking about a relatively low mortality rate. And a massive violation of rights and freedoms of individuals. And what is the limit? I mean, sure, we could lock down people for long enough to reduce the statistics on almost every crime in the United States. How many rapes happen in any particular 3-week period? We could lock people down for 3 weeks to save those rapes. It would be immoral not to, right? So you cannot, in the name of protecting rights, violate rights on a massive scale. That's just not a solution to a problem, particularly when you look at Taiwan and you look at South Korea, where they had a lot fewer cases than China, where a lot less mortality in China, and they didn't lock anybody up, right? I mean, South Korea locked up a small section of a city, but they almost didn't. Why? Because they allowed private enterprise to develop private tests and deploy them in mass and found a solution that didn't violate anybody's rights. So they are pro-freedom solution for these things that don't necessitate it. And now I just want to address your point about Pfizer and Moderna. No, there's no cooperation between the government and Pfizer and Moderna. The government basically said two things, and this is the Warp Speed program. They said, for COVID, we will reduce the amount of force we impose on you. That is, we will make the bureaucracy more efficient. We will have fewer regulations. We'll still have force. We'll still have regulations. There'll just be less of it. So you can go through phase 1, phase 2, phase 3 faster, but you still have to do them. You still have to follow the bureaucracy. You still have to fill in the forms. You still have to do all the things that the institution requires you. We'll just make it faster. And second, we'll buy the vaccine in advance. That was the money, right? The money was not for development because the vaccine was developed in 2 days. The money was, we'll buy it in advance to give you an incentive to produce more. That wasn't a public-private partnership, and it failed because look at the distribution. Distribution is an unmitigated disaster. So, no, I don't think government has added anything in the United States to the fight against COVID. I think at every level it has been, it has hampered. Even at the point of, you remember the days where there were shortages in toilet paper?
I do.
Yeah, that's created by government, by the fact that you cannot raise prices. You cannot raise prices if you're selling toilet paper. If prices had gone up as demand had gone up, there would have never been shortages, and you would have provided a huge incentive for manufacturers to produce toilet paper, and prices would have come down, and there would have been plenty of it. Same with masks, same with ventilators, same with every single product. The thing that created the shortage was government intervention, was government controls, was government regulations. It added nothing.
Would you allow me one opportunity to respond, or?
Sure, why not?
Okay, so I would say, I take your point about the, again, like I said, the pacing of how quickly vaccines got to the market or to the general public, and also how many regulations were removed. Maybe we could have stretched that further, but I also think that in common sense terms, or in the common sense of most people, there is a trade-off between the speed of getting it out and the viability of the product. And we do return to the regulatory agencies just because imagine if every time, we could do this with literally any response to a public health issue. Every time we needed a drug, a company just creates it. There's no regulations. Like you said, in 2 days, we already had our vaccine. Imagine if we could just roll it out.
So let's imagine that. Let's take that, Jonah. Let's imagine that. Imagine a world, make it simpler. There's no FDA. There's just no FDA. The government has no responsibility whatsoever with drugs except for one function. It catch fraudsters. That is, if I'm selling this elixir that cures COVID and it's just Coca-Cola, they arrest me for committing fraud, right? I'm lying about the product. But imagine, other than that, no FDA, they're not involved. What would actually happen? What would drug companies then produce drugs and just willy-nilly sell them on the marketplace, and we would all just buy them willy-nilly? And when people died, who cares? It wouldn't affect anybody, and we wouldn't care. The drug companies wouldn't care. Our doctors wouldn't care. The pharmacies wouldn't care. The insurance companies wouldn't care. This would just be a crazy, insane world. Is that what actually happens in marketplaces? What would actually happen if there was no FDA? What would happen?
Even with regulations.
I'm asking a question. Just answer the question.
The answer to the question is that even in the presence of legal penalties, they already will roll out to the public drugs that don't work.
That's just not true.
Antidepressants, psychiatric medications.
Jonah, that's just not true. I mean, they might not work as effectively as some people would like, but the idea that multiple drugs out there that don't work and people just prescribe them for fun is nonsense. Plus, I would argue that to the extent that we have one centralized agency called the FDA that approves everything, you're much more likely to get drugs out there that don't work than if you had actually competing FDAs. So imagine what would happen in a free market if you didn't have an FDA. Well, doctors would need information about drugs because doctors are not in the business of killing their patients. They're not interested in giving their patients drugs that A, don't work, and B, might be damaging to them, particularly in a free market where patients might actually shop for doctors because they're not just, they're not just mindlessly guided to doctors by the bureaucracy. So doctors have an incentive to cure their patients. So doctors need information about drugs. Now, you might say they might not want to trust the drug company. So what is a solution to that when we have informational problems, information asymmetries? Well, you get agencies that come about. Agencies that then compete, that provide information to doctors about drugs that are coming out. And might do the testing very similar to FDA, but the difference is that you have competing agencies. Some of them might be better than others. Some of them might do it better and they would outcompete their competitors. You would have an incentive to do good. You see, the FDA only has one incentive, and that is not to let a drug go out to market that will hurt anybody. So even if a drug will cure 90% of a certain cancer, if it does harm to the other 10%, then they won't release it. But that doesn't make any sense. If I had the option and if I had cancer, I'm willing to take that risk. And who is the bureaucrat to tell me that? So imagine a private FDA telling us, here's the risk profile of the drug. Here's what will happen. Hey, doctors, you and your patient, you and another individual, you decide whether you should take the drug or not. We're not deciding whether you should take it. We're just providing information. And then you give hospitals, you give doctors, you give patients, you give insurance companies an actual incentive to actually think about the treatments that they're getting, the efficacy of the drugs that they're using. Today, a friend of mine who's 87 years old was admitted into hospital with COVID. And, he has lung problems. Everybody thought he was going to die, right? It was a sure thing. So he comes in, and a friend of mine who's a doctor, is a friend of his as well, went to the doctors and said, look, give him the antibody treatment, the treatment of the Trump card, which is amazingly efficacious. Doctor said, let me see, here's the checklist. When I'm allowed to give this. No, he doesn't qualify. No, I'm not going to give it to him. Right? So she twisted his arm and basically cajoled him into giving him the treatment. Then give him Remedsphere. No, he doesn't qualify to get Remedsphere. Doctors today are bureaucrats. They follow FDA guidelines, which is a checklist. Gone is the idea of personalized medicine, which is the idea of individuals making decisions. Not
on that note, we've got two other questions.
Sorry.
This is a really interesting conversation, though, so maybe there's a way you guys can continue after the event.
I want to say thank you so much for that
Jonah.
engagement.
Thanks for asking the question.
Yeah, that was
Sorry
great,
I went so long.
So that was a great
ahead.
conversation, but I'm going to let Isaiah ask a question and then Bryce, and then we'll wrap up today's meeting.
My question is, could you give like a short little elevator pitch on what objectivism is and what it means to you?
Yeah, objectivism is Einmann's philosophy. It's a philosophy for living. It's a set of guidelines in a sense of how to live your life in accordance with reality, in accordance with what's really out there, not in accordance with commandments, not in accordance with wishes and whims and somebody telling you how to live, but in accordance with reality and with your own reason. It's a philosophy that tells you that you should live for yourself, that you should live to pursue your values, attain your happiness, make the most of your life, live the best goddamn life you can live. You only have one shot at this. There's no afterlife. There's no alternatives. There's nothing else. This is it. Every second you live is a second you'll never live again. So make the most of it. It's not about pleasing other people. It's not about pleasing your mother. It's not about pleasing the state. It's not about pleasing your tribe. It's about living. the best life you can live based on your mind, based on your values, based on your choices. And the only political system that makes such a life possible. So notice a comparison with many libertarian theories that start and end with politics. Objectivism is primarily focused on thinking and on living. And then it says, to think and to live, what do you need? You need freedom. You need a political system that protects you from force and coercion and authority and leaves you free. So freedom is a means, not an end. It's a means to your happiness. It's a means to your ability to pursue values, your values, the choices you make. So we should be free because we want to be happy, and we need to use our minds in order to be happy. That's a quick summary. But read Ayn Rand. I mean, everybody should read Atlas Shrugged and The Fountainhead. I mean, that way you'll know where Rourke's name comes from.
Thank you.
Yeah, I also recommend The Fountainhead. Okay, Bryce, last question.
All right.
Hey, Bryce.
Hello. So I was wondering, with the COVID masks, there's obviously a trade-off. You put a piece of cloth over your face, you might reduce the risk of spraying a disease. And they said, a year ago that maybe 2 weeks or a month of this and it would all be over. But a year later, we're still wearing masks. So I'm just curious as to what you think about masks and them being mandatory versus voluntary.
Well, I certainly don't think they should be mandatory. Of course, a store, a restaurant can mandate it because it's their private property, and he's putting on his mask. You're afraid that Zoom will give you COVID. So of course they shouldn't be mandatory, but a store, it's their private property. They can basically tell you that on their property they require it. But look, I think masks are make it a little safer. Make it a little safer for you and make it a little safer for other people around you. I think it's absurd that people are wearing masks walking outside when it's windy. I mean, the chances of you getting COVID outdoors while walking is basically as close to zero as you could imagine. Even if somebody opposite you is full blown on COVID with the wind and outdoors, you're just not going to get it. So, but in an indoor setting, when you're close up and you're talking to one another, masks are really helpful in terms of preventing contracting the disease. Now, young people, if you're under 30, I don't think you should wear a mask. So take it off. No, because so what if you get COVID? I mean, I was saying 10 months ago, I wish I got it. I'd like to get it over with. Get on with my life. Enough, right? The mortality among young people from COVID is basically zero. I mean, statistically, it's as close to zero as you can get. I mean, this is a really, really, really deadly disease if you're over 75 or if you've got like type 2 diabetes. But if you're healthy and young, it's just not a risk. It's not a risk. Not riskier than a lot of other things that you do, that you guys do. Probably drinking as much as some of you do is probably a bigger risk to your health than COVID is. And I'm not going to mention some of the other kind of drugs that you might partake in. So, it's absurd the way we've dealt with it. We treat everybody the same. This is what a state does. This is what the government does. Treats everybody the same. We could have early on, and you said they told us a month and it would be gone. Yeah, it should have been gone in a month. If they'd done the right thing, it would have been gone in a month. If we'd isolated old people and let young people live, it would have been gone in a month. Why couldn't you guys go to the beach? Why couldn't you guys go out and party? Just stay away from your grandparents. I mean,
okay, I'm going to give the last word to DJ, who's currently interning at the Tennessee legislature. So he has an interesting point to add about that.
Yes, I did, and this is public record. This is one of the bills that's being run by a member of the Tennessee State Legislature right now. I can't remember who is actually. The bill that they're running is to make it illegal for any private businesses in the state of Tennessee to force people or to discriminate against people that will not wear masks in their private business. So basically, it's saying that businesses can't refuse to serve people that won't wear a mask.
Yeah. I mean, that's compulsory mask wearing, which is what a lot of states are talking about, what Biden has talked about. I don't think he has the authority, and he'd have to have Congress. That's why we don't have it yet. Yeah, I mean, this is the kind of collectivist, treating everybody the same, treating us all just as a mindless mass who can't think for ourselves, can't do our own risk assessment, can't do our own, we don't value our own lives, we're just going to take stupid risks. And the guy in Washington, D.C. or in wherever, Nashville, Tennessee, knows better about how I should live than I do myself. But that's the mentality of a statist, and that's it's really, really, really tragic to see it in the United States.
Right.
And it's just awful because it's the...
Oh, go ahead, DJ.
Oh, I was just going to say it's just funny to me because it's like the different side of the same coin as mask mandates. It's like the opposite. It's mask on.
Yeah, I mean, why can't we just let private individuals make decisions for themselves about who they want to deal with and who they don't, what risks they want to take? And in my own business, why can't I decide wear a mask, don't wear a mask? I mean, it's my business, my home. I get to decide. But we're a long way from that in this country, a long way away from that in this country. We've turned private businesses into public spaces where the government can tell us how we should behave. And we're about to do the same and conservatives and liberals all agree, to Twitter and to Facebook and all of that. So there's no end to where we could take this discussion, because it's all relevant, right?
Yeah, on that cheery note, I'm going to end the meeting there at exactly an hour, pretty much. Thank you so much to our speaker, Yaron Brook, for coming on Zoom for us tonight and giving us a really interesting lecture. And I'd also like to thank everybody who participated with their questions. You know, discourse right now is really important, especially because we can't be together face to face. So I'm just glad everybody showed up tonight, and I hope you have a great night, everybody.
Good night, everybody. Thanks for doing this.
Thank you, Mr. Brook.
My pleasure.
I'm the one that named Rourke, so.
Oh, there you go.
Yeah, so she came by that name on purpose.
Oh, I see it now. All right, same family name. It took me a while. All right.
But she chose to read the books.
Read the books, guys.
Hopefully modeled a rational life for her, and she chose her own path. So it was her own free will. I did not indoctrinate her with objectivism or libertarianism.
Well, you can't indoctrinate people with objectivism. It's a contradiction in terms. You might be indoctrinating them, but with something other than objectivism. Because the whole point of objectivism is to choose. She got
there on her own with a little help from her name.
Choose and think for yourself. That's what it's all about.
Exactly. Thank you so much.
Have a great night. Bye, everybody. All right, now what do I do?